Ms. Subhashree is a healthcare professional with more than 10 years of experience in the medical devices. She has a special interest and passion in towards moving and working for maternal and child health, currently supporting Ekam and Academy outreach and resource mobilization activity. Now let us welcome Ms. Subhashree to deliver her.
Thanks, Amit, for the introduction, and glad to be here. Very inspiring to see the journey of what you guys have done globally. And in the next few minutes, I will run through the India operations and the activities that we do in India. So each year around the world, more than 6 million children die before reaching the fifth birthday. And these deaths can be avoided through preventive approach, which is through the knowledge and infrastructure upgradation by raising awareness on various aspects of health and well-being in the community on maternal child health and engaging them in a holistic approach to help them make informed choices. And the other one is a curative approach where we support in providing emergency and life-saving medical support. And as UNICEF quotes, 70% of early child deaths are due to conditions that could be prevented or treated with access to simple and affordable interventions. And we would be able to make it more sustainable and workable when we do a collaborative partnership. And this is being worked very well for Ekam, where we have been very successful in joining hands with a lot of private sector, public sector, civil society, and community, and had been glad in making great partnership in this journey. Today, Ekam Foundation works in 7 states of India across many projects within reproductive, maternal, newborn, child, and adolescent, with a view to do a holistic reduction in infant deaths. A model for Pan-India is what we're all talking about on the Sustainable Wellbeing Initiative, which helps in reducing neonatal and maternal health. And more about the model, I will brief on the coming slides.
Subhashree, can you turn on your camera? Maybe you can stop sharing the screen and you can just read out so that we can see you on the screen.
Yes, sir. My bandwidth is pretty bad, so that's the reason I've just turned it off.
No problem. Please go ahead.
Yeah. Thank you. So through our extensive network, Ekam receives regular requests from immediate life support from different parts of our network, which include the trained nurses working in more than 1,000 plus primary and community health centers, who along with the support of multiple people such as biomedical engineers, Anganwadi workers, volunteers, community health workers, identify these children from, on the urgent needs, which comes to us for the treatment support. And we have a dedicated helpline number through which these requests for support are received. I will play a small clipping of the children that are being treated.
Subhashree, can you make it full screen, your PPT?
Yeah. So all the children that have been treated are growing up healthy and happy, and we thank all the donors, hospital staff, private and public health system who've helped us in this process, and to all the network who've reached out to us, because it is an opportunity for us to support them through you. Thanks for all the supports you've been providing to Ekam, and it has made a huge impact in the lives of so many kids and families around. And these activities are supported for children who are between the age of 0 to 19 years, who basically suffer from various life-threatening complications such as cardiac illness, kidney ailments, and so many other aspects. And the scope of this project extends to providing support like emergency care, hospitalization, drug support, investigation, and so on. And we've been getting these support from 38 districts of Tamil Nadu, and we've recently been getting multiple supports and requests from other parts of the country as well, from Andhra, Karnataka, and West Bengal. And all of these children are basically followed end to end from the time they get admitted, basically from screening to admission to discharge. The entire growth cycle of these kids are being followed by our district coordinators and staff. And other than this direct medical support and activities that we are doing as a part of Save a Child campaign, Ekam in collaboration with various state governments, have recruited staff nurses at various levels of health systems, starting from medical colleges to primary healthcare centers. And Ekam also has been very instrumental in making up the working uptime of the equipment, which was working at 14% in many of the government hospitals to 98% by directly impacting so many lives of these children who have been admitted in the neonatal intensive care units. Other than that, we've also been doing multiple level of community health activities, and we've done more than 40,000 plus awareness programs in Tamil Nadu, and we've also starting it across the different parts of India. With all of this, we are so proud and happy to say that we've touched more than 1 million lives in last 10 years through various activities that have been conducted on this journey. And we're trying to make it much better in the coming years to come, because every life matters. This is something which Dr. Sai spoke about on creating sustainable community at grassroots level, because we wanted to create a permanent solution as an organization. We don't want to just work on projects, do something temporary and go off. Whereas we wanted to create a process that kind of works on its own. So that's the reason why Ekam does a lot of activity at the community and grassroots level through various programs. Maybe I'll show a small clip of activities that we do as a part of a sustainable well-being initiative through a video. So I've highlighting few activities such as ensuring early identification of children. This supports an on-time referrals through various camp settings that we do in different parts of the community, which supports in direct reduction of preventable deaths, and thereby helping them to be getting treated on time. Other than the medical camps, we're also running a lot of awareness programs in the community and supporting and upbringing the health literacy for these mothers and people in the community, and various capacity building of village health staff through kitchen garden and herbal garden, which you see here, are done in various community schools, which has a direct impact to these food which these kids eat. We try to grow a lot of homegrown food in multiple villages and a community, which kind of has a direct impact on the nutrition. So these are few activities that we've been doing as a part of a sustainable well-being initiative, and training volunteers and youth is one big piece of work that Ekam is trying to do, and trying to create a mentorship model within the community, which will have its own sustainable once it has been set. Engaging the right partners, as I already mentioned, Ekam has worked closely with many state governments across India and in various projects, including recruitment of staffs in government and government hospitals at various levels. We've been involved in building mentor nurses training program in Tamil Nadu. We did a lot of programs in maternal and child tracking in different parts of the country, and Ekam has also been involved in various primary healthcare assessment and needed support through the donation that has been raised by our global chapter. So many other projects that have been well appreciated and accepted, and these projects will also be taken up in a policy level. So that is the amount of success we've been able to mark in our journey with our activity in maternal and child health space. So the UNICEF project that we are currently working in Tamil Nadu is a blend of community and facility activity that we are doing. And we are working across different places in Tamil Nadu to ensure uninterrupted essential services of reproductive, maternal, neonatal, child health and adolescents, including immunization service, home-based care and support, and also working on doing a lot of community level referrals through the mentor and the volunteering system that we have developed in the state. And through this program, Ekam is working a lot on community level interventions to bring in convergence, which Dr. Sai quoted, And with the support of state government and UNICEF, we are working on this mentorship model, which is creating a sustainable, which will also create a sustainable health outcomes to various programs, which includes capacity building, where so many organizations have come forward to partner with Ekam on multiple aspects to support the state during this COVID scenario, making them as change makers in the community to support awareness of maternal and child health programs. And these health volunteers are also helping in timely referrals of these high-risk pregnant mothers and also supporting us in multiple child referrals from the community. And this program is ongoing, and we've been able to reach out to multiple pregnant women and support them in all possible ways we could. More on the project, I have Mr. Kaushik from UNICEF who will be highlighting on the key areas and the outcomes on the coming slide. So this is something which I wanted to end the note with. We all know that women, children, and adolescents are the most powerful agents for improving their own health and achieving prosperous and sustainable society. And as an organization, Ekam is working towards that. And we would welcome all of you to join this wellness movement. Thank you so much for the opportunity.
Thank you so much. It's always amazing to see how the impacts of what we do in the overseas chapters, and see what's done in India and see how it's impacting and the way that people over there do it, because it's a different process in every country and every region. So thank you so much for providing us that insight.